So it's a real pleasure to be here today and to do this plenary session. So I'm a severe hemophiliac type A, and so I've been living with hemophilia for the last 45 years. And today I'm driving. I'm gonna explain an initiative at the University of Montreal, and the first reason why I'm doing that is because I'm an hemophiliac and because of the way I was raised as an hemophiliac. And I truly think that patient partnership is part of the DNA of the hemophilia community, and that we have a role to play, not only inside our community, but also outside of our community to communicate this model. And the first, maybe great symbol we have is this logo that everybody knows. This one is the Canadian Society, Canadian Mafia Society one, with these two guys, hanging each other, and it's a real symbol of partnership, and it's been created at the start, actually, of the World Federation of Hemophilia. There is a polemic on who actually drove this logo, but it doesn't mind. What is important is that I believe very much that at the heart of hemophilia community founders, there was this vision of partnership, and partnership is part of our strongest value, and we need to protect it as a huge richness for our community. So I have no conflict of interest to declare. I'm going to talk about patients a lot in my presentation, but when I talk about patients, I include families. So I'm not going to say patients and family, but I want to be clear that families are included in patients. And because families, as you know, play a huge role in the hemophilia communities. So we are in a very specific period of time right now, because the world actually is discovering that patients have experiential knowledge, and that this knowledge is a huge added value for our healthcare system evolution. And it's a strange thing to discover now, but that's the way it is. And there was we were actually living in a world where there were patients on one side and healthcare professional researchers on the other one. And today there is a world trend that makes these two universes link actually, and it's a good news. So we talk a lot about patient engagement today, patient engagement in quality and safety improvement in hospitals. So again, it's very surprising that we've been thinking about quality for many years, but without patients. But that is changing now, and hospitals are engaging more and more experienced patients to work with them on how to improve quality and safety. We have more and more patients also engaged in research, not as subject of research, but as partner of research. So in the governance of research, in the definition of orientation of research, and even in the co-building of research, the co-designing and co-building of research, because we think that, again, experiential knowledge of patient is a huge added value to find new innovative solutions for our healthcare system. And also there is a big trend around engaging patients in education, and that's what we've been doing at the Faculty of Medicine of the University of Montreal for the last 6 years, engaging many patients to teach our medical students the art of communication and collaboration, because every experienced patients have this ability, those competencies of communication and collaboration, and that's what we have proved in the last years, that they can make a huge difference in terms of medical education. And that is very focused on how to really deploy in a healthcare system worldwide a partnership in care model, and to strengthen all these approaches that are very important when it comes to patient empowerment, that are shared decision-making, self-management, centered care. Centered care, there is a session this afternoon on centered care, but we talk a lot about centered care, but how much is deployed today in our healthcare systems? That is a good question, and I think there's many, many things to do to make sure that we're going to be able to really practice centered care in clinical settings, and therapeutic education, and so on. So when it comes to partnership in care, is how we empower the patient to become a real partner in care. So there is this trend, and the BMJ, British Medical Journal, did actually in the last 3 years produced many articles on that, on the patient revolution related to those themes. So I'm part actually, and my team, the Center of Excellence on Partnership with Patients and the Public of University of Montreal, we are one of the actors of driving this change. I'm co-leading this center with a doctor, so I'm co-leading it as a patient and with a doctor, and the team is constituted of researchers, patient experts, clinicians and health managers. So we are a living lab of partnership on a day-to-day basis, and this team is dedicated to build the science of patient partnership and also to help clinicians to transform their practices. So we've been driving many patient engagement projects in education, how we can engage patients in education, medical education, but health sciences education, how patients can help students to maybe develop their practices in a meaningful way for patients. We also help many hospitals in Quebec, in Canada, to engage patients in quality improvement processes, but also in their governance. And we've been also accompanying many networks, research networks in Canada to engage patients also at the governance and the project level. So that's what we do. We've been driving more than 100 projects of patient engagement in the last 5 years. And mainly the reason why I'm doing that, and the reason why I have this, I try to make this vision something real, is because, first of all, I'm an hemophiliac. So the subject of this presentation is to demonstrate that partnering with patients and families has always been part of the DNA of the hemophilia clinical practices. Is it generalized? Is it all clinical settings, hemophilia clinical settings, who are actually practicing in a partnership way? Certainly not. But it's from the start of the hemophilia community, one of the drivers is about partnership in practical, in clinical practices. The hemophilia community governance also has always been based on partnership. Look at what's happening here. You know, it's a partnership between patients, families, clinicians, industry, and healthcare and many other healthcare professionals. And it's not an usual thing. You know, it's very rare to have this kind of partnership at the level of a community and with a very wide, large, actually, gathering like this one. And I think our community is a world reference and can play a major role for the chronic patients communities who don't have the benefits or don't have the chance to have this kind of model. So that's where I was raised, like many of you of hemophilia here in this room. I was raised, in the 70s, and as you know, hemophilia, even in Western countries, in the 70s, were very difficult to live. With my mother, that's me and my mother. I had belly, a big belly at that moment, and that's what I like to show this picture, because I had more belly at that moment than now. So it reassures me. And but we were raised, in a vision of self-management and patient autonomy. And that's what hemophilia is all about. It's making sure that we find a treatment for all, but also that we make sure that people with hemophilia, living with hemophilia, patients and families can be as autonomous as possible. And at the early age of at this period of time, my mother was trained by the French Hemophilia Association at this moment, and by our clinicians to diagnose me and treat me, and then 6 years after that, I was able to auto-diagnose myself and treat myself. So it was we're talking about the 70s. So it was very innovative for this period of time, and it's surprising because it's still an innovation in terms of when it comes to clinical practices. It's not evident today in many ways of engaging patients in their own care, but that's what we've been doing. That's what we've been trying to do in the last 40 to 50 years in hemophilia. So again, it's not a reality everywhere, but it's part of what I think the community try to push forward. So when it comes to this kind of vision of care, we're not talking about giving care to patients. We give care for patients, but actually what we're talking about is giving care with patients. And that's where the model of patient partnership, it's what it's all about. It's about considering patient as actor of care, because we are a key success factor of the care process. We are a care team member as patient and family, because we are the extension of the care team when we are outside of the hospitals. We have experiential knowledge that can be mobilized for our own care, and we can develop competency and we can take care of ourselves. And that's what partnership is all about. And again, it's not a there is a lot of work to do on partnership, because this vision of having a patient as an actor of care is not strengthened enough today. But I think again it's part of the hemophilia model in somehow. And I raised this. It's Frank Schnabel, one of the founder of the World Federation of Hemophilia, and I was raised, with these great leaders of the hemophilia community, who was actually people who try to live with hemophilia in a normal way, and access to normality was the challenge from the start. From the start, what the hemophilia community, what we want to do is living with this disease as a normal person, and that was part also of what the hemophilia community pushed forward in terms of care. And so it's very focused on life project. I was 5 years old, a severe hemophiliac, and I wanted to ski, and I had the chance to have at that moment clinicians who didn't try to stop me, they just tried to help me to do that and to give me the skills I needed to manage my own risk and ski in the more secure, safety way possible. And that's all about hemophilia also. It's about a partnership between our clinicians and us in order to make sure that we're going to be able to realize our life project despite of our disease. And we know hemophilia is not going to be cured in the years to come, and we're going to have to live with hemophilia certainly for quite a long time yet. And we need to have a normal life, and we need to work in partnership with our clinicians to make sure that we're going to be able to access to a certain normality. So, and to do that, it looks simple, but it's not simple at all. It's very complicated, because it's all about recognition of a complementarity between health professionals who are actually disease experts, and we don't discuss about that, but also patients and families who are living with an illness expert. And we need to have this kind of complementarity, reciprocity, recognition, interdependency, and that's how care process should work. And that's in this kind of mindset that we can eventually work in a partnership model, co-building and co-lead together. So the question is, today, so let's say partnership is in the DNA of the hemophilia community. But what is the situation today? And I'll let you answer to these questions. I know what's happening in Canada, in France, and in other countries, but I let you just assess the situation in your own country. How much do we work in partnership? How much this model was, let's say, part of our DNA from the start, from the vision of our founders? How much it's a model that live actually in our clinical settings today? So when we talk about partnership, we talk about empowerment and autonomy. Okay, actually maybe the first objective of the care process is to make sure that the patient is autonomous as much as possible. That's what partnership is all about, giving the power to the patients. So it's about adapting information to the patient and his family. It's about integration of patient life context in clinical reasoning. Just not in clinical reasoning, the objective shouldn't be only to focus on to cure the disease or to treat, but also to make sure that the patients and his families will be able to take care of themselves when they're going to be out of the hospital, when they're going to be back home. And that's what partnership is all about. The recognition of this interdependency. If we think the care is just given inside the hospitals, inside the clinical settings, when patients and family are going back home, it's going to be difficult for them to assume their responsibility. So it's all about making sure that we integrate life context in clinical reasoning. It's about also co-evaluation and co-building of care plan. It's about making sure that the care plan, again, is not only focusing on a biomedical perspective, but it's focused also on the specific context of the patient. So for doing that, we need to share, we need to discuss, we need to negotiate, we need to make sure that we work in partnership. You know, we have a huge challenge in terms of non-observancy of treatment, non-adhesion of treatment today, and it's mainly because of that, because most of the care plans are not co-built with patients. You know, they are pushed to patients. So when it comes to apply them after that, it's more difficult for patients to give sense, and that's why we have these. That's one of the great reason why we have so high level of non-compliancy for patients today. It's about respecting the patient's choice of treatment. It's about, you know, discussing treatment and making sure that when the choice is made by the patient, that first of all, giving information to make sure that the patient can make his own choice, and then when this choice is done, whatever the choice is, that we respect this choice and that we make sure that we're gonna support the patient whatever the choice he made. It's about therapeutic education. It's about skills development. So partnership is about giving the power to the patient by training him, by giving him the information and the education he needs to take care of himself, to auto-diagnose himself, to treat himself, and to make sure he's going to be as autonomous as it can. It's also about peer-to-peer support. And that's one of the great, I think, assets of the hemophilia community. We understood very quickly the power of peer-to-peer support. We understood that patients have knowledge that can be transmitted to other patients, that can be taught to other patients. And that's a big, actually, part of partnership, because it's putting the patient in a situation where he's not only someone with a disease, he's someone who has power on himself, but can also give back to his community, and that's a big part of this community. And like I said, empowerment. So I think that's I would say, the triggers of partnership. And again, I let you evaluate how much your own clinical settings and your own communities are working actually today in partnership. And I think it's again it's a very important evaluation to make as a community. So let's say that partnership is in the DNA. It's part of our tradition. Let's say it's for the last 40 to 50 years. You know, I remember my grandfather talking to me about one of the World Congress in Japan in the 70s. And at that period of time, they were talking already about, you know, how we can empower the patient community. So let's say it's part of our DNA, it's part of our tradition. So to make that happen, we need to question also ourselves as a community, what is the situation in research? Are we in a collaboration? Is there a collaboration between patients, scientists, and clinicians in research in the community field? That's a question I'm asking you. How much, you know, patients are included, not as subject of research again, but as partners of research? That's the question I'm asking today. How much patients are included in education? So we know there is a tradition also of sharing experiential knowledge in the hemophilia community. So we know that clinicians can transfer knowledge to patients. We know that patients transfer knowledge to other patients. And I guess also patients are transferring knowledge to clinicians. So when it comes to having a community working in partnership in education, it's about this circle actually. Not only clinicians transferring knowledge to patients, patient to clinician, but also patients to clinicians. Patient to patient, but also patients to clinician. So what is where are we today on this knowledge circle? And also in our governance. And that's a very important part. And I think that's why the hemophilia community is so strong in terms of partnership. It's because from the start, the governance of the World Hemophilia Federation is actually assumed by patients, but with a kind of co-leading approach with scientists, clinicians, and healthcare professionals in general. And that is true at the international level, and I guess, and I'm not sure because I don't know all of the national chapters, but I think it's part of how the national chapters are working. You know, there's always this big collaboration between, and that's what the logo is all about, you know, collaboration between the patients and scientists and clinicians to make sure that we advance together. And again, it's very rare today. You know, we are maybe one of the we've been doing that for 40 years now, and there's no big example of other communities who's been working in this partnership model that I know for 40 years or more than 40 years. So that's a big asset for us. So again, I really think that we are in our DNA actually have this partnership approach in our DNA, but we need to ask this question, can we go further in that? And how much can we be a model for others? And so if we believe it's an essential legacy from our history and from our great founders, we need to protect this partnership, we need to cultivate it, we need to improve it, and we need to scale it up and to share it. And we need to, first of all, to recognize that it's part of, again, it's one of our strong values. We need to do that, and I will finish on that, because I think we need to give back also. And I think I know we have many challenges to face in our own community, and that's sometimes a criticism I have at the Hemophilia community is we are very strong working together in our own community, but how much we share that with other communities who are patient communities who are also struggling. And so how much can we contribute to chronic disease management at large? We have a model, we have an innovative model. We can maybe help some other communities to work differently and to be more efficient. We can be also an example on how to efficiently face non-compliance issues. I think we because of the kind of partnership in care we've been promoting, we have some solutions to propose in terms of facing this challenge. And also, I think because of the way we've been, structuring, organizing information to patients and families, we can be also a response to growing needs of patients and family to access knowledge and skills. It's 50% of the population in Western countries have a chronic disease. And all those patients are looking for information and way to receive accurate medical information. And I think we have a model to present here, and that is worth it for them. So again, I believe very much that partnership is part of our DNA. I don't know if we realize enough that it's part of our DNA. I don't know if we protect it enough, but I think we should think about that. We should make sure that in our clinical settings, it's a driver for all our clinical settings all over the world. And I think we should help some of our communities maybe and give them, what we've been learning for the last 40 and 50 years in terms of patient partnership. So thank you very much. Thank you.